I've been with Mercy Said No since 2016. And honestly, what I would say is it has been a unique experience because you get to see the need of our people and you get to see how you can actually give back to the community where I came from. Unfortunately, the current state of the health system in Nigeria is very dysfunctional and not meeting the needs of the teeming population. The current population of Nigeria is estimated to be around 230 million people, with a very youthful population, a median age of about 18 years. Therefore, we still have a lot of health problems related to the youth population and even the infants. But of importance is the high mortality and morbidity rates, which is very worrying.
Over the course of years that we've been coming for medical mission, you cannot exhaust the healthcare need of the people. I think quite a number of us who come in here, we come in with highfalutin ideas that we want to save the country. We can only contribute our own quota. Sometimes I see that when we come in and we have thousands of people, it can be very frustrating for us not to be able to see all the thousands of people. But we are limited in what we can do. So whenever we are coming in on mission like this, we should be a little more realistic. We cannot cure everybody.
Poverty is endemic in this country. Many people are very poor. I mean, the basic minimum salary per month has just been increased from about 30,000 naira a month to about 70 or 80,000 naira a month, which is nothing really. For somebody who has a wife, 3, 4, or 5 children, 80,000 cannot take you anywhere.
You get to see a lot of children. There was one that really broke me, and it was a child that I think somebody poured hot water on the child, and my goodness, I could not contain myself because the little boy did not have, one, he didn't have the proper health care. They couldn't take him to a doctor. So his first relation with a doctor was when we came on ground. And that shook me to my very bones, because I had a child that was his age, and it was heart-wrenching, but I'm grateful that we were here to help him.
One of the 3 important gateways of the Basic Healthcare Provision Fund is dysfunctional, let me say so, in the sense that less than 10% of the Nigerian population have national health insurance for health. And this is why currently about 60% of money income is spent on healthcare services. The catastrophic spending is about 60-65%, which is a shame. You can see from this medical outreach that there are lots of people who cannot access either the primary health care, secondary health care, or tertiary health care, but they rather come here to your outreach to benefit from your wonderful healthcare services. I must commend you highly for that.
There's a popular saying amongst us Nigerians that health is wealth. And that is true. The wealth of the nation is the health of the citizens. And until we realize that there is a need for us to operate and to maintain the health of our nation, we'll continue to economically suffer and be backward in the way things are in this global world as we live in.
It has really been a blessing to work with the organization, to be in this environment, helping people, saving lives for real. It has been really rewarding. And when I came last year, I came in with an anticipation, but then I didn't really know what I was gonna meet. But coming last year, I was really impressed by how much we were doing and how much people needed help. And coming in this year, I came in with more vigor, I came in with more desire to help, and I was more committed. And it has really been a blessing working with doctors from the US, people from the US who are not medical people, in fact, but volunteer their time, their money, and their efforts. And Mercy Said No organization and all our partners have been just awesome people. Working here has been a really big blessing to me, as a matter of fact.
This is a great mission and it's needed in this space, especially. Nigeria is a good ground for this kind of aid. People need help, people need to learn more about their health, people need to, just have a better quality of life, and that is what Mercy Said No is bringing to the people.
It's been a beautiful experience, volunteering to help people, bringing smiles to faces and relieving people of their sufferings and pain.
I didn't used to think I was good at math, but the way I've been counting those meds, like by fives, I figured it out and it's all good. Yesterday, I was collecting cards from patients or, the people we're serving, and I was directing them to come to the front so that, the people who had been there the longest, basically it's just organization, logistics, communication, smiling, making people feel welcome. So it doesn't matter what your experience is, you can volunteer here too. There's a place for you. What's your strength? Even what's your weakness, we'll help you work on that. And it's a lot of fun. The people here are wonderful. And yeah, it's a great experience overall. So come join us.
Moving forward, as more and more of us get into this, we'll be able to bridge that gap. The next thing we'll have to do is find means in which we can sustain this. Sometimes just that 1 week or 2 weeks of medical missions is not enough. We see patients who have chronic medical conditions, and taking a patient and treating them for high blood pressure for just 1 month is not enough. You need to be able to sustain it, to give them that care that they need for their lifetime. Someone who has diabetes and needs to be on medication, you need a lifetime commitment to be able to get those people to get to where they need to be in terms of health. And that's where we need partners locally who will take up the challenge, who will see that need, and who will help in providing sustained care for these patients that we're seeing on a day-to-day basis.
The next thing we're also doing is teaching philanthropy. So we're bringing medical students while they're still learning to become doctors about giving and giving back.
Being a part of the mission this year has been really special for me. Getting to travel around deep into Nigeria, serving the good people of the country, especially the underserved, the people that are unable to get medications or get medical care for themselves. It has been really fulfilling, really life-changing for me, and this is something that I look forward to doing again and again every year by God's grace.
This year, we were able to see many more people because we had a bigger team. This year, actually, our team has been huge. We had a team of over 60 people. We had a lot of doctors, nurses, volunteers, therapists, health nutritionists, dentists. I mean, it's just been great. So with all these people coming together, we've been able to see so many more people than we have in the past years. Now, this is a collaborative effort, and we've done that with Grace for Impact, which they do the eye, and our partner that we've been partners and collaborating partners since so many years now. That's Royal Wellness International, and we've also partnered with the Ife Medical School alumni. It's just been a great partnership, a great collaborative effort, and being that we have the same passion, no one is in it for the accolades, but for the betterment of our people, the betterment of our brothers and sisters, the children. If you look around you, you see so many people that are looking for aid, and we're here to just give them just that.
I'm honored to be a part of this amazing team. I believe you don't wait for the big things to happen, you start with the small things. Nigeria needs, the Nigerian population, especially the older population, needs a lot of medical care, which they're not getting. So we're here to give back and to do the little we can do, really.
If you're in the healthcare field, if you have a passion for people, if you have a desire to help people and to make an impact in the life of people, Medical missions is one way in which you can do it. It exposes you to the needs of others. It gives you that ability to, like the scripture says, to help those who are in need. It gives you that opportunity to take the skills that you've learned and use it in a selfless manner to help humanity and other people like you.
The one thing that keeps me going with this every year is the fact that our logo, save a life, save a generation. If we can help save one life, you can save a generation.
Mercy Said No exists because our heart bleeds for those who suffer in silence, those who can afford or have access to basic health care. The need is overwhelming. There's a need to do more. So if you're a medical professional, volunteer, or someone willing to make an impact, whether through your time, your skill set, or financial support, we welcome you to join us. Together, we can be the hands and feet of mercy. Together, we can say no to suffering. Join us.